Welcome to another episode of our MedSynapse podcast series on mastering communication skills in healthcare. I am Dr. Simran, and today we are tackling one of the most challenging aspects of patient care, that is breaking bad news. Did you know that effective delivery of bad news can significantly impact a patient's emotional well-being and trust in their healthcare team? Research shows that compassion and clear communication can even influence treatment adherence and overall satisfaction. Joining us today is Dr. Vishal Parmar, an expert in communication strategies for healthcare professionals. Dr. Parmar, thank you for being here.
Thank you.
Breaking bad news is more than just conveying information. It's about managing emotions, maintaining trust, and setting the stage for future care. Today, we will explore practical strategies, share real-life examples, and discuss how to handle this challenging aspect of patient care with empathy and professionalism. Dr. Parmar, what are the core elements for delivering bad news in a way that it is both clear and compassionate?
Breaking bad news is an art. I cannot teach you, but what we need to understand that bad news is never expected. We always hope for the best, expect for the best, and anything is not right, we don't want it. So it comes as a shock. And when anyone gets a shock, it's important to know or give them support on how they are going to react. Some people become quiet, some people start crying, some people start laughing, some people get a shock and get unconscious. So lots of responses, and it's a highly emotional situation. So whenever we are going to break the news, we must make sure that we are breaking news in the proper calm environment with appropriate person and support available. See, if before I mention you that if I are going to break a news, say someone is going to die, or something that someone diagnosed with a cancer. So the patient and the supportive care, like his or her husband or wife or friends or elders or in communities should be there, and then we should break them. Many times that breaking bad news require the extensive support of family. What happens, we have seen especially in the kid or in some families also, that parents don't want to break the news in front of parents till sometimes because they want to prepare them mentally, or family and relative don't want to break the news in front of patient, especially when they are diagnosed with some serious condition or a life-threatening condition. So in that case, we need to respect it, and whatever help they are asking, we need to provide it. But yes, in the clinical settings, in the ICU, when we are going to break the news, just make sure we follow all these basic steps of how to communicate and offer them proper empathy, sympathy, and compassion. For example, it's in pediatric, it is very common about suddenly a newborn baby was in the postnatal ward, suddenly aspirate milk and get choked and require immediate resuscitation and shifted to an ICU. It is a very traumatic experience for mom or new family. So when you are break the news that we kept your baby on ventilator, so starting, yes mama, please come. Do you want anyone to attend these conversations? Maybe her husband or her mom, her dad, or family member are present. And yeah, unfortunately, because of this episode and baby has some breathing problem, we have to keep baby on the ventilator. So just break the news and pause. Give opposite person to time to react. Yeah, we need to give them time to react. How he or she going to react? And when someone in so much emotional stress or shock, they may not be able to absorb all the information. Maybe the immediate concern for them, is he going to die or not? It is a commonest question parents and relatives are asked us after breaking the news. And there is no straightforward yes or no answer. Depending on a situation, if he or she going to die, maybe not immediately, then we can say that mostly with the proper treatment we have so much positive results, but finally we can tell what how it goes. So that's how we can do. When breaking bad news is an extreme negative condition, so when something is negative, we should consult the parents with the positive. Like if we have to, so after some cardiac arrest or aspiration in baby, we have to keep the baby on ventilator or patient on a ventilator, and we break the news. The first thing, oh, he is going to die. Maybe, may not be, we don't know. But we cannot give you short answer. But at the same time, we can see that, yeah, it is a risky condition, but at present, after on ventilator, his heart beating is fine, his blood pressure is maintaining, his oxygen level is good, with the support, of course with the support of machine. We have done the report, there is a mild, done some reports. One report says he may have low hemoglobin and some infection, but otherwise all reports seems fine. And now we are see how it goes up next 48 hours, so we can have better idea how he is going to recover. So among all this problem, we are going to give so and so support and so and so medicine. Generally, final picture we might need time to have it, but at present, as he is maintaining his heart rate, blood pressure, and he has started some feeding from the tube, so it could be a good sign. Let's see how it goes. So always offer, after breaking bad news, always offer some positive news without giving false reassurance.
So it's like breaking the news, but again giving a positive note at the end that keeps the hope alive in the patient, and he cannot just go completely negative. It keeps them positive as well. So that keeps the balance actually in the patient's mind, that yes, there is a ray of hope that might change the patient's scenario or the condition at the moment. Because any which way, that is coming from a doctor, that is coming from you, so it will be obviously of great assurance to them. So moving ahead with this, how do you balance being honest with maintaining a sense of hope for the patient?
See, honest means not brutally honest. Truth should be sweet. Truth is bitter, but should be said in a sweeter way. And nobody likes to have a bad thing with them or with their families and friends in life. So obviously, when we are going to give them some negative thing, must give time to react. And how the opposite person going to react, we need to support them proper empathy, sympathy, and compassion. Like, I can understand what you are going through, but tell me there are some positive things in this situation too. let me tell you, I know how does it feel when someone has to pass through it. And if I have that experience, the same experience in the past, I can tell you that I had also have a similar experience in past in my family, and I know it's very difficult time. But telling me just with the hope and proper treatment, with the time, thing might get changed. But let's give a time and let's hope for the best. So another thing is that, and the good thing is that something and we have so much advanced treatment is available. Our doctors are expert here. We have all this expertise available here, and all this medical team taking care, and they are giving them best efforts, and we have so much experience there. So at present treatment is going on, and we will update you from time to time. So see again, when cure is not possible, give them care. Let them understand, let them believe that we as a medical team are doing our best to save his or her relative or baby, whatever we can do. Or we are giving one of the best possible treatment in the world to save their near and dear ones. So that is how important कि everybody is human. Everyone knows that what can be worse going to happen, but still they want from their side, they want to give their 100% because they don't want any regret from their side. They feel that if my near and dear one is in distress or any problem, it's my duty to give him maximum support. So we should also appreciate their efforts also, near and dear ones. And many times after breaking bad news, how a person going to react, it may be start some unusual behavior or getting unconscious. At the time we can ask psychologists help also, repeated psychologist sessions to accept the news, to believe in the news. Daniel would be a first reaction. So see, there is no one particular formula that if you follow this formula and you can do the best. It's our human to human interaction, and definitely always take the help of the family member because they know that how the particular person is going to act and react. So that is the best way that how to
manage all of these.
handle such situation.
So moving ahead with this, as you mentioned that there might be different emotional reactions the patient might show at that time whenever we are breaking a bad news to them. So what techniques do you use to handle those patients?
See, the immediate emotional reaction, if you think that after breaking the news, some patient might go into a shock, guilt. Some might become silent. Some might get an emotional outburst. Some might start worrying, restlessness, etc. So generally, I just give them big pause and time to react. Let them react. When their so-called emotional outbursts settle down, then we proceed further. So big pause according to situation is important. See, when any bad news comes, sometimes we don't accept it. It's not true. It's wrong. Sometimes we react over emotionally, like जोर से रोना, मारपीट करना. Many times after breaking news, they might feel guilty. मेरे ही गलती ही. It's my fault only. I should have taken them to hospital earlier. I should do this. So after all this time, then they might shout a second opinion also, second opinion, third opinion, fourth opinion. They know they won't. After all this procedure, they trying to accept the news. Until and unless they accept the news, a further compliance with treatment, we might find it difficult. But that is how most of persons react, and we should give them time to accept the news. Someone takes few hours, someone takes few days, but it depends on the individual, personal, emotional, and social, cultural belief. That's all. So, not sure formula. There are. I cannot teach you how to do it, but just calm down and listen. Your observation will help you how to deal with this. But yeah, always be honest, be polite, never give false reassurance, and always tell them in this I know that there is a bad situation, but what are still positive things with us and what we can do and what we are doing. So these three things will help us to build the trust, and that's what important.
And how can you adapt your approach based on the patient's personality or situation? Since you mentioned listening to the patient is more important at that time, and according to that only we can even give them a proper support or maybe talk to them or whatsoever is required. So how actually we can differentiate at that time? Is there something that we should be prepared for?
See, the mostly what happens, how the patient and relatives are behaving. We should have a word with our hospital staff, nurses, junior doctors, uh, billing staff, receptionist staff, referring doctor. So they have an idea how these people are going to behave or how they are behaving. So it will give us the idea of what kind of person we are dealing with. Because in a ward, nurses are staying with the patient and parents 24/7. Although in shift, but they are continuously in touch. The same like junior doctors. Referring doctor might know the person and family for the years. They have an idea. So good conversation with your hospital staff, medical team and referral doctors will help you, definitely. That is how we know what kind of person we are going to deal with. Also, we cannot predict 100% how he or she is going to behave, but this will give us idea of what kind of the personality that particular family carries. So I will give you my example. In my younger few years after, within 1 or 2 years after passing out my post graduation exam, and I was handling a newborn baby in the NICU, and it was just a premature baby, and we kept on the oxygen, and baby was fine. Baby definitely is going to survive, but his father came in the hospital at a midnight, around 11 to 12 midnight PM, and asked that I want to talk with the doctor. I said, okay, let us talk. So I will give them all this information and tell them that there is some risk till baby is in ICU, but I think according to present situation, he might be recovering well. Then suddenly start the gun and kept it on my forehead. Tell me,
Oh my God.
he will live or dead. So we don't know how he or she going to react. Okay. So that is how the common people, we don't know कि किस person के पास क्या है, मतलब
What state of mind, what is he thinking, what actually he is going through because of the loss that he's going to have. And it is really again the safety terms comes up, like every doctor needs to have that, because eventually it's not your fault or it's not the medical fraternity which is at fault. It is some things are beyond everyone's scope. So
how a person going to react, we don't know. So
but
that is what is
was-
important, that when we as a very traumatic, well, not a traumatic but very shocking experience. Although at that particular time his relatives are there in meeting, and they just took the gun from his hand, and they
My God.
they given to someone and वो बाहर लेके गया. But see, the sometimes a person is mad, but the fellow person with him are not that mad. So it is
Yes.
always advisable to have a word with all the referring physicians, referring doctors, their nurses, your junior doctors, your even class 4 patient also, class 4 worker also, because many times they have an idea of what they are going to do, what they are doing, conversation in the hospital waiting room. So it is they will give us idea. And when we are going to break the such in such highly emotional situation, when breaking bed is always do conversation in the audio visual recording room. Like your counseling room must have some audio recording and video recording facility. So in any situation we have a proof and we can be safe, and he or she also get conscious that he is there under video, so they don't react unnecessarily, or they don't get violent oftenly. So that is how we have to handle it. But I have seen that in such highly charged emotional situation, if you give some good calm word and good if you do good counseling, have good words with them, reassuring words in a positive note, so it helps. See, we need to be sound logically. We need to be sound like logically we are giving care. See, the someone is, I know your patient, your friends or your wife is in very critical condition, but with all this support, like for the breathing we are giving on a ventilator, for the blood pressure and heartbeat maintaining, she is on some inotrope medicine which helps to maintain the blood pressure and heartbeats, and we are giving different medicine to cover her infections, and she has a low platelet, so we are giving a platelet. So every care we are going to we are giving her. Our expertise team of the doctor is round the clock looking her vitals, constantly monitoring, and we are constantly in touch with the different doctor also. Many times they want them to, you should inform each and every important things to their trustworthy family physician. So we should keep them in a loop. We are informing them also, and let's see how it goes. And we are going to inform you time to time. And generally in such cases, we have seen that 90% outcome is not good, but still we are fighting for the 10%. We don't know if he or she in 90% or he or she in 10%. So let's hope for the best, and we are going to give it. So this sound logical.
Yes.
That we have tell them reality, but we should prove ourselves logically that we are genuinely caring for their person. We are not just giving our lip job. Our words should match our actions,
Yes.
and that's all they want. So with such approach, I feel we can reduce the 90% of the violent behavior of the persons. Still 10% are there, but we cannot control them.
Definitely. So, what are the key follow-up steps after delivering bad news, and how can you handle this process in a virtual setting?
Personally, virtual setting don't break the news when it is so severe. Don't do. Just you can say that if you get some news or some bad reports, you can ask them to come to meet this. But I think I don't feel that, because in virtual settings, there can be lots of misunderstanding. And if it is a serious matter, person should come physically to have a news. So I discourage when you are going to break the bad news in virtual settings as much as possible. Sometimes when it is unnecessary, sometimes when it's necessary or it's a life threatening, then we might have to call and give them. But until and unless it is necessary, don't break the news on virtual setting.
Yes, please.
because there is lots of medical legal consequences on how you break the news and do follow up.
So, what kind of medical legal actions can be taken if someone is not delivering the news that appropriately?
No, no,
Are there
it's not
some
like this medical.
implications?
See, the I am breaking news and he doesn't like it. He feels that you are doing negligence. He will do the case.
My God.
If I break the news on phone, if I break the news on phone, and sometimes I told them I, I will be there in 1 hour, and if I get stuck in traffic, what can happen?
That's actually not in your hand.
So that's why that breaking bad news should be at the side with audio visual room, and whenever possible try to do maximum conversation on the bed only, even if in ICU also, in front of the patient, and tell them, let them see their patient. If patient is in ICU, to let them see that how is the patient is doing. You should provide them all these gloves and all this mask and everything, but best possible conversation is near a bedside only, or at least we should let them see that how much we are doing. Generally in ICUs, entries are restricted. Entries are restricted because of so and so reason. That is fine, but still we need to allow every relative to see the baby or see the person twice a day, because it helps us to build a trust and transparency, because they are noticing each and every detail what we are going to counseling them, and they will recheck it. The same is going on, same is going on, same is going on. And at the same times, what happen when up in a ICU condition or in serious condition, our whole medical team should communicate with the patient in the same line, like a senior does. Or many times they are going to ask many unnecessary if and but questions to junior medical team and nurses, and many times based on their answer they might interpret a thing differently and they make a issue. So either we should train our staff on how to deal with such patient, and that is why I think the counseling and communication skill training is important for the whole hospital staff, because they are always want many anti-social materials or a person जो ऐसे लोग हैं जिसको कोई इश्यू बनाना ही है, वो कहीं ना कहीं से कोई फॉल्ट निकालने की कोशिश करते हैं, और when they pick someone then they make a issue. So I know we cannot make a system 100% proof, but everyone in the hospital setup should talk on the same line. That's how we can deal it. If they cannot talk, then they should tell them politely, sir, I don't know more thing, will you please ask a senior doctor please. So that is how things work.
Thank you, Dr. Parmar, for your valuable insights on breaking bad news. Effective communication in these moments is critical for patient care. But again, following your advices, likewise, the best advice, I guess, which is that recording everything, whatever is happening, whatever you are delivering to the patient, how the patient is reacting to it. So everything should be done completely under the CCTV surveillance, or maybe under some surveillance, so that even they can't react that bad, and even we are safe in that situation and we cannot fall into trouble. So this is again very valuable to each and every doctor, because these are very small things which are missed out very easily. Whenever we are breaking a bad news, maybe in the corridor, we are talking to the patient and suddenly we started speaking to the patient, and we avoid those things. But this is again very important and should be noted by each and every doctor, that delivering such news can have a great impact on them as well. So this is important.
And the important thing is that always have a conversation with the referring doctor and referring physician.
Then
and I think most of the patient will do first thing after breaking news, they will most of them will try to connect with their physician for the reconfirmation. Yes, ideally before breaking the news, we must have break the news to the referring physician if he or she is available. And we should know that what is his or her opinion and how they are going to react, what is there.
Yes.
Always try to talk to a junior doctor.
Yes.
So they will give us idea that how he or she is going to react and act. So that's how we can be prepared mentally.
Definitely. So thank you, Dr. Parmar. It was wonderful having you on the podcast again today. Your practical advice and real world examples have been incredibly insightful. And to our listeners as well, if you found today's discussion helpful, subscribe to our podcast for more such advices. Don't miss out our next episode where we will be discussing on managing difficult conversation with patients and families. That's a wrap up for today's episode on breaking bad news. We hope you found our discussion both informative and engaging. Remember, mastering these communication skills is key to providing exceptional patient care. If you have insights or experience you would like to share on our platform, we would love to hear from you. Thank you for tuning in.